So finally joining us is Dr. Jennifer Durenberger, who is the Director of Racing for the Massachusetts Gaming Commission. Dr. Durenberger is going to discuss what really can only be described as cultural change in Massachusetts through the cooperation of the regulatory body, horsemen, the racetrack. Significant changes have taken place in a jurisdiction that arguably has been transformed from one of the least regulated to one of the best regulated over the last couple of years. So, Dr. Durenberger.
Thanks, Mike, and thanks to Mr. Bowen and members of the Grayson Jockey Club Research Foundation, both for this morning's panel and for what's yet to come. My name is Jennifer Durenberger, and I currently serve as the Director of Racing for the Massachusetts Gaming Commission. We're a new agency, we're a merged agency, Racing and Gaming, and we've been in charge of parimutuel operations in Massachusetts since January 1st of last year. I'm here to tell you today what I hope you're going to agree is a really good news story about a regulatory agency. There we go, okay. The old Massachusetts State Racing Commission was one of the Depression-era agencies. Its enabling legislation passed in 1934. Suffolk Downs opened in 1935 to a crowd of 35,000 people. And some of the great names in thoroughbred racing have had their picture taken in the Suffolk Downs Winner's Circle over the years. But Massachusetts has perhaps been more notable for its greyhound and harness racing. The dog tracks were second to none in their day, and just last year, a mass-bred trotter, Royalty for Life, won the Hambletonian. But here's why Massachusetts racing hasn't been on the radar for most of you in the room lately. We're what's popularly referred to as a referendum state, and in 2008, a major earthquake in Boston struck the Massachusetts racing community. A successful ballot question abolished greyhound racing in our state. That significantly cut the Racing Commission's activity and therefore revenue. And there was an expanded Gaming Act on the horizon that was going to create this Gaming Commission. It was considered imminent, and so the Racing Commission was temporarily moved to the Division of Professional Licensure. This is a setup very similar to what we see today in Florida. But the Gaming Act wasn't passed until late 2011. So the Division of Professional Licensure continued to oversee parimutuel operations in the state for a period of about 4 years, until January 1, 2013. So why is that important? I think about what's happened in our industry at the national level since that time. We're talking about a period of significant regulatory and cultural change in our industry. Handicapping aside, think for just a moment about all the data collection that we do now on the regulatory side of our sport. A lot of it is the result of these summits, from the Equine Injury Database to the Jockey Health Information System, the Racing Surfaces Testing Laboratory, horseshoe characteristics. And what do we do with this information? What have we done with it in the last 4 years? As stewards of this sport, and this is a professional sport with legalized wagering, we as regulators have a responsibility not only to ensure data provided to our customers is accurate, but also to consider this data carefully when we're promulgating new regulations and implementing new programs. This is just as true of the Uniform Medication Initiative as it is of the individual track-based programs that we've heard about this morning from Finger Lakes and from Woodbine. As regulators, we used to introduce new rules or amendments to rules piece by piece, often reactionary and in response to problems, and we sometimes had to take our best guess at the most appropriate solution. Today, I think we see a series of rules being introduced proactively in response to data collection and scientific research, and not crisis. These rules, in particular those addressing safety standards, medications, and veterinary practices, are meant to provide clear guidance to our occupational licensees while protecting our athletes and the integrity of our sport. These new rules are sensible, enforceable, and defensible, and that's what I mean by regulatory reform. During that same period, though, we've embarked on some very real cultural reform. Witnessed the tremendous work of our thoroughbred retirement groups and the formation of the Aftercare Alliance, the good work of the Thoroughbred Charities of America family, the Jockey Club's Thoroughbred Incentive Program, and the rapidly increasing popularity of the various off-track thoroughbred horse shows, such as this weekend's totally thoroughbred horse show at Pimlico. And perhaps the biggest cultural change of all, at least from my perspective, is the movement toward transparency. As we heard earlier, today, 93% of all racing days are reported into the Equine Injury Database. Through the NTRA Safety and Integrity Alliance, track operators at 23 facilities pledged to meet a code of standards and opened up their operations to visiting accreditation teams. And today, a trio of stewards accredited by the Racing Officials Accreditation Program officiate over races accounting for approximately 85% of United States handle. This is real cultural reform. This is part of a commitment that our industry has made to not just talking about what we should be doing, but actually agreeing to do it, being held accountable, and exposing what was long guarded as proprietary data to members of the media, parimutuel customers, and competitors alike. I would argue that during the last decade, and particularly these last 5 years, the horse racing industry in the US has worked collectively to achieve this winning trifecta of safety initiatives, sensible regulation, and commitment to aftercare. We've done this on our own, through facilitation of open and honest dialogue about what needed fixing, through the tireless efforts of scores of committed individuals and entities, and through creative fundraising mechanisms to ensure that good ideas could actually be implemented. So what does this have to do with Massachusetts? When we took over the regulatory oversight of racing, we were in the fortunate position, as Mike said, of having a lot of low-hanging fruit that we could gather. And we had some roadmaps out there that showed us just to go out and how to gather it. We had significant amendments to rules on safety equipment, medication, and veterinary practices going through the Rules Committee, or RCI. The Safety and Integrity Alliance had a list of best practices, and the Governor's Task Force in New York had just laid out a series of key policy recommendations. So others drew up the playbook. All we had to do was implement it. So who's going to be on the team? This picture here, these are the members of our commission. They are 5 full-time commissioners who could not be more interested in doing what's right by racing. We stand ready in the racing division to help them do that however we can. One of our initial mandates was to enhance the professional resume of the racing division, so we brought in some great big picture-minded folks. We gave existing staff the tools they needed to move forward with us, and we assembled what I would describe as a great team. I couldn't be happier with their dedication to our program. We closed down the old state testing lab. We contracted with a new one that was undergoing the RMTC accreditation process. We adopted all of those model rules that we talked about, and then we put everybody to work. It's a list of key reforms from 2013. I'm not going to go through them all. They're in the materials provided in the program notes. But remember this, you could still give phenylbutazone on race day in Massachusetts through the 2012 season. That was our baseline. That's where we started. And by year 2, I would argue that our veterinary programs and medication rules are now easily among the most comprehensive in the country. The programs we've implemented complement the emphasis on safety and aftercare that our operator already had in place when we arrived. Prior to the Gaming Commission coming to town, Suffolk Downs had been nationally recognized as a leader in aftercare initiatives, was accredited by the Safety and Integrity Alliance, and had been advocating for the medication and veterinary practice rule changes we just discussed. We view this in a lot of ways as a strategic partnership, which is designed to achieve that trifecta of safety initiatives, sensible regulation, and commitment to aftercare. If you race in Massachusetts, our governing safety standards are a combination of model rules, house rules, and NTRA best practices. Our regulatory structure maximizes your chances at a level playing field so that the best athlete always has the opportunity to win, both for his connections and for our parimutuel customers. And when the race is over, our operator is often instrumental in finding our equine athletes a second career or a forever home. But we've done more than just change the rules. We've worked really hard to effect cultural change. We wanted to be not just at the forefront of medication reform, but also at the forefront of the movement to demonstrate through our actions and our words our understanding of the important role that we as regulators play as stewards of our industry. The racing division formally adopted this horse's first philosophy. You'll find that in the materials provided, so I won't read it to you. But I will tell you that no single action we've taken has been the target of more compliments, particularly from our occupational licensees. We asked the members of the commission to endorse a set of welfare guidelines published by the International Group of Specialist Veterinarians, and they did, unanimously. And we unveiled a set of website enhancements in the interest of transparency. If you go to our website, massgaming.com, and find your way to the Racing Division page, you're going to find portals to MGC at Plain Ridge Racecourse, that's our harness track, and MGC at Suffolk Downs. Once there, you'll find copies of medication reference manuals that we put together for our trainers. I call that colloquially the How Not to Wind Up in the Steward's Guide. Our steward's daily reports and rulings are there. Our vets lists are there. And interestingly, just following the last discussion we had, our vets list also lists the trainer of record at the time that that horse went on the vets list. What you'll also find there that I think is unique to Massachusetts is that we're publishing quantitative test results for non-steroidal anti-inflammatory medications and blood gas as part of our transparency initiative. I'm happy to take questions later about the drawbacks to this, but in the interest of time, I'll just tell you that we haven't seen any. And if our little experiment is useful, if there's other jurisdictions in the room or watching this that are considering doing this and want to point to us as an example, we're happy to break that new ground. If it fails for some reason, failure in Massachusetts just isn't that spectacular. Those of you who know me know my favorite saying is, what's the worst thing that they'll say about us if we fail? We got caught trying. We got caught trying to do the right thing, so bring it on. Here's an example of our non-steroidal test results, which you'll find. I'm going to end with a couple of case studies that are going to drill down into the change that I'm proudest of bringing to Massachusetts. This is from May 10th. You'll notice there's a horse there. I'll use my pointer, my Mary Scalay pointer. His name is Lover of Art. Lover of Art returned with a phenylbutazone level of 4.1 micrograms. Our threshold is 2, and you'll see that we refer you to view the relevant steward's ruling if you're interested. As a regulatory veterinarian, before I took the director of racing job, what's interesting to me about this horse is that the next time he was entered to race, on May 19th, he was a morning scratch by one of the Suffolk veterinarians. We're coming up on 7 weeks now. Today's July 8th. He has not been back in the entry box. In my anecdotal experience, and I'm wondering about Dr. Hanolt and Dr. Scalay's experience as well, having a high post-race non-steroidal level appears to me to be a significant risk factor for winding up on the vets list at some point in the recent future, in the near future. I think those would be really interesting statistics to run. I spent some time working for Dr. Arthur at the California Horse Racing Board, and the veterinarians there are fortunate enough to work under a rule which permits race day and penalties to be imposed on trainers who send horses out to work off the vets list and return with a post-work non-steroidal overage. There's no question in my mind that having this rule in place constitutes a best practice, and we promulgated a similar regulation in our first round of rulemaking. I can think of no more important rule for protecting the safety and the welfare of the horse. Why do I say that? I'm going to put on my regulatory veterinarian's hat for the moment and take off the director of racing hat. And if you've paid attention to nothing else that I've said today, please pay attention to this. When a horse goes on the vets list, it's because that horse has been identified as an at-risk horse by the very professionals that we've hired to make that call. I would argue that the most important thing we ask our regulatory veterinarians to do is exactly that, identify the at-risk horse. And as regulatory veterinarians, we have 2 diagnostic tools that we can use to make that call. 3 if you throw in our experience. We have our eyes, and we have our hands. These are really good tools, but we don't have imaging. And when it comes time for the trainer to demonstrate that horse's soundness to the veterinarian, and that horse is presented in a condition that compromises the veterinarian's professional judgment, everybody loses. Non-steroidals take those two tools away from the veterinarian because they affect the way the horse moves, our eyes, and because they reduce heat, swelling, and the other signs of inflammation that we're looking for with our hands. You cannot ask the regulatory veterinarian to make a professional judgment on the soundness of a horse when you're asking him or her to do it blind. And some of the levels we see in these post-work bloods, I remember one horse in particular that returned with a level of 33 micrograms. You're asking the regulatory vets to do their job blind. So we adopted this rule. In our first year, 3 out of 64 of the horses working off the vets list had a non-steroidal overage. They were all for phenylbutazone. It's about 4.7%. Compared to 0.86% of our post-race samples. That's a little higher, that 0.86%, the national average, but just remember that we went from race day bute administration to a level of 2 in a single emergency rule change, so I was real happy with that for last year. For this year, we've had 1 come back out of 22. We're still running about 4.5%. That's compared to, we're at 0.64% right now for post-race samples. This means that the likelihood of a non-steroidal overage following a vet's list work is about 7 times the likelihood of an overage following a race. And talking with Dr. Arthur as I was putting these numbers together, that ratio appears to be consistent with what they're seeing in California. So what I want to do is I want to just take a look at the horses we're trying to protect with this rule. We've had 4 violations since this rule went into effect. And I'm going to just let you make a decision about what you think about these horses. This is horse number 1. Horse number 1 had raced once in July of 2012, and then had been scratched by the regulatory vet in the morning. We have a nice long layoff line there, almost a year. On June 1, 2013, which was opening day at Suffolk Downs last year, he attempts to work off the vet's list, and he comes back sore. Well, June 22nd, he comes back again, makes an appointment to work with the vet, and we do, when they make the appointments with the vets, we tell them they know that the race day rules are in effect. He returns fine, and his post-work blood was a phenylbutazone level of 8.9 micrograms. On July 10th, he comes back again, tries to work off, fails to make a publishable time, and returns sore. And he's had no published work since that time. So you can look at this 2 ways. Personally, I feel like this is a failure. I feel like having this horse go out there on July 10th and have a career-ending injury in a train, I think that's a failure. You could look at it as a way we kept this horse off the racetrack in the afternoon. If we'd stopped 1 work sooner on this horse, he may have had a productive second career. I don't know where he is right now. I hope he's doing well. Horse number 2, September of 2012, races at Suffolk, beats 1 horse, chart reads gave way. Comes back, he's a vet scratch in the post-parade 3 weeks later. Nice long layoff line till June of 2013, attempts to work off the vet's list, returns sore and had a bute level of 3.7. In July, he manages to work off the vet's list, races a couple of times in July and August. Then he winds up being a morning scratch in August of 2013. Runs a couple more races, becomes a post-parade scratch on October 5th, hasn't had a published work since. So I loved Mary's term communal risk management. Operators get concerned about field size, I get that. This horse was in a couple of races, he beat a couple of horses, he may have made races go, I don't know. But what I ask our operations group is this the kind of horse that you want to have out there? Right? He's not taking any money. This horse was 80-something to 1 or 90-something to 1. He's not taking any money. And if he's out there and he presents an unacceptable risk, which arguably he doesn't belong out there. Horse number 3, I'm just going to give you an abbreviated chat. August 13th, he wins. Then he's sore in the test barn, tries to work off the vet's list, returns okay, post-work blood with a bute level of 5.9. Little layoff line there, doesn't return. His next published work is in December. I'm going to stop in February of 14 because he went to race in another jurisdiction. There's no indication in Encompass that he was ever seen by a regulatory veterinarian before he did that. So in our mind, that horse is still ineligible. So I'm going to stop there with him. And finally, horse number 4. This one's really interesting because we adopted this winter the multiple medication violation rule, which will assign points to trainers who have multiple medication violations, as you might guess by its name. And this trainer is going to be affected by that. So because our rule says that we can apply race day penalties to these post-work butte overages, we are interpreting that to mean we can assign points. And that's going to affect a guy like this. So this horse in October of last year did very well, finished second. The next time he was entered to race, he was a morning scratch by our vets. Nice long layoff line, comes back in April, tries to work off the vets list, returns okay. He's got a post-work butte of 7.1. Successfully worked off in May, raced one time, didn't beat anybody, comes back, races, returns sore. This trainer last year, speaking of the 5%, this trainer last year we had 13 medication positives at Suffolk. This trainer was responsible for 2 of them. Now this trainer this year has this post-work high butte. So had the multiple medication rule been in effect last year, this would be his 3rd violation within a 365-day period, and so he would have a mandatory suspension imposed on his license. So this will be very interesting. We pointed that out to him as part of the proceedings here, and we'll see where he goes from here. So that's the story that I have to tell you from Massachusetts, and I'm happy to take any questions.
I have a question. So horse number 3, the one who you guys, he's still on your list.
He is.
And he raced in February of 2014 in another jurisdiction.
He did.
What do we do about that as an industry? I mean, for I don't want to call it the majority of jurisdictions, but a vast majority of jurisdictions are sharing that vest list and not letting that horse run. But what do we do as an industry, and this is rhetorical probably because I'm not going to put you on the spot, to stop that horse from running that's still listed in Massachusetts someplace else?
It's only half rhetorical, Mr. Ziegler, because I'll put on my racing officials accreditation hat. One of the points of emphasis for this year, and I think possibly last year too, was reciprocity of vets lists. So if a horse is ineligible in one jurisdiction, he should be ineligible in every jurisdiction unless the licensee, we do have a remedy, the licensee can prove, the burden's on them, that he shouldn't be on the list and should be eligible. More than welcome to plead that case in my jurisdiction, but I won't entertain it. So if we have a horse that's on a list somewhere, go get right with whoever put you on the list before you come see us.
Okay. What about when you started publishing the results of the TCO2 and the NSAIDs, what kind of pushback was there from the horsemen?
Interestingly, we had no pushback at all from occupational licensees. Private practitioners love it. They're fascinated by it. The trainers like looking at it. The concern, of course, is are people going to titrate to these levels? And I think you have to look at blood gas differently than nonsteroidals. With nonsteroidals, if anyone in the room thinks that you can titrate to a nanogram level with a nonsteroidal in an 1,100-pound animal, you can't. You know, good luck to you. On the blood gas side, there is an argument to be made about titration. And I have 2 answers to that. One is that if we as an industry have decided that a number is a number and that number is based on science, then as a regulator, it's not really my business as long as you're under it. The counter-argument to that is if people are playing close to the fire, then that may result in more overages, you know, accidental overages because they were trying to get too close. But interestingly, our website didn't go live until a month into our harness meet, and our numbers, our average daily numbers from our harness horses, they've gone up just a little bit since we started publishing, but we had a month where we weren't publishing. And now we've had a month where we were publishing, and we haven't noticed any appreciable change in those levels since we started publishing, so for whatever that's worth.
Anybody in the audience have anything for Dr. Durenberger? No? What about, since change implementation, what have the results been as far as catastrophic injuries? Any significance?
We inherited a pretty good catastrophic injury rate when we got there, considering that, like Dr. Hannah, and like the Turfway experience, if you risk out our horses probably all have 5, 6, or 7 of those factors. I think the level when we came in was around 1.8, and I think we were at 1.8 last year. Catastrophic injury rate. A lot of you in the room, a lot of you have heard me say, I think how many horses we don't lose stopped becoming an acceptable outcome measure when Edgar pulled at Barbaro. We really are looking at the whole picture, at what else we've done. And I think the other changes that we've instituted have done so much to enhance the welfare of all of racing's participants that I would like to use something like that. It's difficult to assess. Welfare is really difficult to assess, but just based on stakeholder comments and things that people have said to us, the things that the private practitioners have said to us about the change that they see in the business model and how people deal with their horses, I think has been rewarding. And I don't know how you measure that as an outcome, but I think that's worth looking at.
Fair enough. Anybody else? Here comes the microphone.
Hello, Dr. Alan Schultz. I'm a medical practitioner, and I was wondering, what kind of stuff do we do, or do you do, to promote jockey health? And in particular, wouldn't you think jockey health would promote horse health? And is there anything, in the works, or have you all thought about that policy?
So that actually cuts both ways, and that's a great question. As part of our first round of rulemaking process, we worked with Mr. Beeks and the Guild, and we adopted, I think, most of the rules, either the model rules regarding safety standards and some additional language that they requested. So we try to make life better. Actually, I think at Suffolk, all of those had been in place by House rule before we got there. So now they're regulations. I think that if the horses are treated properly, if the horses aren't over-medicated, if the people who work with them are committed to the health and well-being of those horses, that makes the jockeys and the exercise riders safer as well, because those horses are better to work around. They're less likely to have erratic performances. They're less likely to injure themselves in racing. So I think that cuts both ways.
One comment about jockey health and actually horse health. There's a very good paper that Peta Hitchens did with Sue Stover's group on jockey injuries or jockey falls, particularly as it's related to breakdowns. About a third of the breakdowns, jockey falls, are related to horses, either sudden deaths or most likely musculoskeletal breakdowns in California. And not only that, they're the more serious injuries when you actually look at the cost to the industry, particularly in terms of workman's comp. So there is a definite relationship between horse health and jockey health in terms of the risk to jockeys. And I think it's something that we have not emphasized enough. And actually, the biggest risk is to exercise riders in the morning. That's actually a bigger workman's comp cost than jockeys, believe it or not. Which gets back to the issue of not looking at training fatalities, which in California, racing fatalities are probably about 40% of our fatalities. About almost an equal amount are training fatalities, and then you have non-exercise fatalities, which are colics, pneumonias, and the like, which are often related to the production agriculture aspect of the sport. So those are important numbers to look at. But jockeys, getting back to the jockey injuries, there's actually discussions in California whether there should be a medical director as well as an equine medical director, specifically to look at jockeys' health, to do with concussions. In California, we now have paramedics on the racetrack, and depending on what county you're in, they consider a jockey coming off of a horse in a race an event that requires a jockey to be taken to the hospital, which some jocks don't like, but it's something that I think we're going to have to pay more attention to.
And I'll add to that, Dr. Arthur, in the minimum standards set by the Safety and Integrity Alliance, there are significant medical care guidelines that we ask the accredited tracks to adhere to. Moving forward, those will include, that's me right here, those will include concussion guidelines as written by a committee of racetrack medical directors and practitioners. And we've worked with the Guild pretty closely on. But good question. Anything else from the audience?
Hey, Michael. I'm Reed McClellan. I'm with the Groom Elite Education Program. And I want to ask Mary, and all for the whole panel, but particularly maybe Mary, because she specifically talked about the people that are invited to the fatality reviews, but also the questionnaires. The first veterinarian talked about it at Finger Lakes. When y'all do the review, and could we get some way in the database information with regard to how the training of the grooms, the people that work with the horses every day? I know Mike includes that in their review of the tracks as far as that, but it's like bonus points. It's not required. And what I'm thinking is we've got programs like Arizona, we've got the North American Racing Academy here now. We do the Groom Elite program at grooms at the racetracks themselves. And one of the things that we've gotten, and it's empirical, I can't put the numbers on it, but from the trainers is that those grooms that are trained to help them do actually help them reduce the likelihood that they send a horse out, because a groom can see something that happens to a horse, a stumble that the trainer's not going to see because he's busy with 25 other horses. I'm just wondering if that's included in the review, and if not, if it could be included in the review.
I think it certainly could be, and I think what I would say for us, at least in Kentucky, is that this is an evolving process, and our biggest concern was that we start with a small success as opposed to going out and intimidating the stakeholders such that they didn't want to participate. So I take Dr. Polk's comment that the owner obviously is invested in the outcome and needs to be included in the conversation. I think, yes, it's absolutely crucial that we start expanding our look to include the animal's caretakers and the people that are in contact with it every day. Some of the things we saw in New York were that a trainer would be at a remote location and it would be an assistant who was in charge of a population of horses. So, you know, clearly there's a trickle-down effect, and you know, one misstep at any one level by a single individual could represent that missed opportunity that could have prevented the fatality. So certainly for us, we're learning and evolving, and you know, I'll be taking today's comments back to our stewards so that we can continue to refine and improve our program. Well, I mean, if there's an overage, then that's posted on our website in our rulings. But in terms of, you know, a search by a specific trainer, no, you'd have to pull up each of the rulings on our website and do your own homework. It's doable, but it's labor intensive.
The Jockey Club ruling, or the rulings database. I think the rulings database that's now put together is searchable by trainer name. So not necessarily the commission, right, but the national rulings database. I believe that through Freedom of Information, yes, they are all participating in it. Is that correct? That's a question for you, Jamie. Okay. Just ping-ponging around the room. So no further questions. I'd like to thank the panelists and turn this back over to Ed with next steps.
Thank you. Thank you all. We were way ahead of schedule. That's very seldom happens. Lunch is not scheduled till noon, so you are free to mill around and visit with each other and wander over to the Limestone Cafe about noon, and then we'll have another session that starts promptly at 1:15. Thank you.